Today we have the pleasure of meeting with Patrick McCormack. He's the director of Uncas Health District here in Southeast Connecticut. Perhaps you could start and share with our viewers, how did you come about, what journey did you take to become the leader at Uncas Health District?
Yeah, so I'm a Connecticut-born resident, and my mother actually was the public health nursing director in the city of Waterbury for a number of years. So I had that background. I had ended up going to Bates College where I got my undergrad, and then I went to the Boston University School of Public Health for grad school, and then I ended up at the Uncas Health District where I've been since 2004.
Wow, what a long, wonderful journey, and great training, great mentors. Did you ever think we would, in our lifetime, face something like the COVID pandemic that we are still going through?
We've been through SARS, we've been through H1N1, we've been through Ebola, and I think what I didn't expect out of a pandemic of this scope was just the amount of time that we've had to spend to work on this particular pandemic. My idea was always those singular day or multi-day efforts we did, because when you're planning, you're always planning for several operational periods. Nobody ever told me we'd be doing operational periods that lasted multiple years,
yes,
as opposed to multiple days. I don't think people realize that our district specifically, we were doing contact tracing back in February of 2020.
What's the mission and vision, and how many staff members do you have to carry out this mission?
Yeah, so people think of us as a district. We cover 11 towns. Right now, we only have 14 employees within the district. Other places, they have the community health center built into it, or they have the lab built into it, or they have social services built into it. Connecticut's a little bit different. We really rely on one another to piece that together to make it whole. And we work with our community partners, our other health districts in the region. Our mission is to promote and protect the public's health in order to prevent illness, death, and disability among its residents. Our vision is healthy people and healthy communities. So again, looking back at ourselves and saying, how do we achieve that? No, I think it's a shared vision. We work with the Eastern Connecticut Health Collaborative, and that vision is across all agencies. The effort is there to work collaboratively to make sure that we provide the same minimum standard of health and wellness for everyone, and then we try to achieve an even higher standard of health and wellness for everyone.
Patrick, what I often think about is we are fortunate here in Connecticut that if you look at the national ranking of states with their health status, we generally are in the top 5 or certainly top 10.
Right.
And yet we know that there are significant disparities. How does a health district start looking at prevention and public health through the lens of social justice or equity?
I think in this particular case, we continue to remember that the disparities are in many cases huge within especially our urban areas, and we have to have people that remember those folks in everything that we do. And that comes down to meeting them where they are and meeting them with people that they feel comfortable with. So we've talked a lot about advocates within the community that reflect the community they serve, trusted community members, things like that. So that's why we've partnered with groups like TVCCA, UCFS, Hartford Healthcare, to go into the community, speak someone's language, see them where they are. Be able to ask them and educate them, what can we do to support you, and then come back later with whatever it may be, the vaccine, whatever we're asking of them. You have to develop that trust throughout the course of the year, throughout the course of our lives together, because we all are one community.
What are you most proud of?
So number one is our staff, this particular office never closed during the pandemic. We were here, and whether people were nervous and afraid for their families, I was very proud of the fact that people were willing to come to work every day, take a certain level of risk. There was a need to quarantine. Well, if one of us had to do it, then you do it, and you're out of work for 14 days. So we were always aware of that, so that's why we were wearing our masks and we were washing our hands feverishly, and we were making sure that we were setting the example for the community. And then we were trying to provide information in real time, which has never been done before in local public health. taking data that was real-time data and providing it back to the public and to our municipalities and our schools. So I'm very proud of the fact that we did it in a way that was professional, it was respectful, and we were willing to say, we may not have all the answers, we're giving you what we know today.
I'm curious, how many phone calls did your agency field?
I mean, on a given day, we were doing hundreds of phone
Hundreds.
calls.
With a staff of just 14?
Yep, and our goal has always been to return every call, hopefully by the end of that business day. And we were fielding calls on weekends, and so one of the things that we did prior to the pandemic, which served us well, we started utilizing technology in a way we never have before. So even little things that don't seem like it's a big deal, but having phone messages that get sent by email to me, so I can review them even from home. I have access to information even if I can't be here. So many of the weekends were spent returning phone calls and answering questions. And so a lot of it was trying to talk people down and say it will be okay, that we're here to support you, you're doing the right thing, please don't be upset because everybody's in the same position right now, here's what you need to do, and then you start the process of talking them through it.
I can only imagine the nonstop nature of what you described. Hundreds of calls a day, adding up. People don't stop on the weekends. How did you and your team find strength? Or what were some of the tools that you found useful for preserving your own self-care as you progressed through the whole pandemic so far?
So I think you need to be able to listen to each other. Because nobody else is going through what you as an agency are going through. Even your family doesn't understand what your day is like when you go home at night. And you also don't want to burden them with what you're dealing with at work. So very often I think we end up using each other as a sounding board. And knowing that you have an employer, hopefully, that will support you through that. And knowing that you can ask for help when you need it is really important as well.
It clearly shows all of us that the battles are not fought overseas alone, and we have ongoing battle against disease disparities and death right in our neighborhoods. Do you ever envision a time where public health finally will get the recognition and the resourcing it needs to be a true national security agency?
So I used to have a health director that was a colleague who said, one of the essential functions of public health should always be preparedness. And as an essential function, it should always be funded accordingly. We have to continue to remind people that the need is there for public health, and public health that is strong, it is supported, and it is consistent going forward. So that's my only ask is that people remember us when things are good, because when things are bad, we will certainly be here for them.
Wonderful. What would you say is the one key lesson learned that you would like to share with our partners at Eastern Connecticut Health Collaborative?
I think that the biggest thing that I found from the beginning of the pandemic was making sure we reach out early to our partners, collaboration, focused agendas, making sure that we didn't step on each other's toes. So I say, utilizing a group like the Health Collaborative it couldn't have come at a better time. I can't say enough about the Eastern Connecticut Health Collaborative and the work of all the agencies that are involved.
More interested in learning, where do you see Uncas Health District in the next 3 to 5 years?
Right. So I'm incredibly optimistic. I think that you come through this with the hope, and hope is very important. But I continue to remind people in our meetings that there is an after effect that occurs from a pandemic like this. We still have businesses that are struggling. We still have landlords and tenant issues now because there's issues around payment for housing. We have a severe housing shortage in our community. People continue to be food insecure and need support. We've never seen the need for food be greater than during the pandemic. We're excited to reopen, and we were excited to get the community back up and running. But we can't forget those people in our community who need us the most. So that's my ask of the community, and that's going to be my ask of the collaborative is, let's figure out a way that we can support those people that clearly have been impacted by the pandemic. And I also want to make sure that in the next 3 to 5 years, we reflect the population that we serve. It's never been that way in local public health, and we're slowly inching along. But I'm hoping there'll be people of color, people that speak multiple languages, people of multiple genders. You know, I want people to feel like we're inclusive, and that our community can be served by people that look like them.
And it takes that special person to do the hard, tough job that health districts do. So we just want to thank Patrick and Uncas Health District for all the work.
Thank you so much. Thanks for highlighting this.
Absolutely. Thank you.
And thank you to the Mashantucket Pequot Tribal Nation. You know, again, as a partner and as a supporter of local public health, but as a great community participant, you know, I can't thank you enough. And